Welcome to Fabric Design Introductory Level 1 Tie-Dye with me as your tutor, Marisha Acqui. Introduction to Basic Health and Safety. Objectives. At the end of this session, trainees should comprehend the role that health and safety plays in preparation and designing of fabrics. What is an accident? An accident is an unintended event that happens suddenly and leads to injury without one's foresight or expectation. What is an incident? An incident is an unexpected event that did not cause harm, injury, or damage that time, but had the potential. What is a hazard? A hazard is a potential source of harm. Substances, events, or circumstances can contribute to a hazard. What is a risk? A risk is the likelihood that a person may be harmed or suffer adverse health effects if exposed to a hazard. Types of hazards: mechanical hazards, strains, breaks, cuts, crush injuries, and burns. Mechanical hazards are those involving injury to the body tissue from objects, heat, or electrical sources. Such injuries can be caused by distractions, using a tool for an inappropriate function, improper handling of a tool, use of tool or equipment for prolonged hours, which may lead to repetitive strain, modification of a tool, using a tool that isn't functioning properly. Chemical hazards: inhalation, skin absorption, and ingestion. Chemical hazards are caused by substances that has the potential to cause harm to life or health. Chemical exposures can occur through breathing in fumes and vapor, absorption through the skin by swallowing, and exposure to vapor due to inadequate ventilation. Work intelligently. Substitute safer materials when possible. Read the labels of your material safety data sheet, the SDS. Never hold brushes or tools in your mouth. Never eat or drink or smoke in your work area. Store tools properly. Keep them in good condition. Never use materials in unintended ways. Keep workspace neat and orderly. Keep floors clean and free of slippery spots. Keep extension cords, hoses, and other tripping hazards off the floor. Minimize the area in which hazardous substances are used. Keep work tools and supplies separate from living area. Clean yourself before entering living area. And ensure appropriate ventilation. General first aid. Consult safety data sheet, the SDS. Seek medical advice for serious incidents. Eye exposure. Hold eyes open with fingers and immediately rinse with water for at least 5 minutes. If wearing contact lenses, remove them after 5 minutes of washing and continue to rinse at least 5 minutes. Note: rinse time depends on the degree of irritancy associated with a particular product. Skin exposure. Rinse skin with water. Inhalation. Move person into fresh air. If swallowed, immediately call the Poison Information Center. These are the numbers of the Poison Information Center and some other emergency contact numbers. Fire safety tips. Have fire protective devices, extinguishers, and alarms. Never store large amounts of flammable or combustible materials. Keep heat sources and ignition sources away from flammable materials. Never smoke in an area that has flammable or combustible material. To avoid spark hazard, ensure that all electrical equipment is in good repair. Store flammable materials safely. Store flammable or combustible materials away from escape routes. Keep a dry chemical or carbon dioxide fire extinguisher within easy reach. How to use a fire extinguisher. Pull the pin, aim at the base of the fire, squeeze the lever, and sweep from side to side. Types of personal protective equipment or PPE. For hand protection, rubber or latex gloves. Respiratory protection, dust or surgical mask. If using chemical, use an N95 or respiratory mask. Body protection, lab coat, apron or coverall. Foot protection, proper footwear such as sneakers or rubber boots. Eye protection, the appropriate type to protect against a chemical splash, such as a safety goggles. And this is what your PPE should look like. Safety goggles, dust or surgical mask, the N95 mask, lab coat, rubber and surgical gloves, safety shoes. And this comes to the end of session 1, Introduction to Basic Health and Safety. Any questions, comments, or concerns?